with you. I've never gone on any tech launch. So this is actually a new thing for me, and I understand that many bloggers, people of influence here, and that's why I'm also trying to recruit you all to help to spread the health message. And the health message is high blood pressure, hypertension. Why is hypertension important? One is that it is the major leading cause of death worldwide, far more important than cholesterol, physical inactivity, obesity, and all the other things you can think of. That is not to say those things are not important, they are important, but the leading cause of death in the world is hypertension, high blood pressure. Why is it so? That's because many people have high blood pressure. In Malaysia, and this is fairly similar worldwide, if you look to your right and to the left, 3 of you, 1 in 3 of you will have high blood pressure. And that's the problem, and I'm sure if I look at here, and somehow we have high blood pressure. We are a little bit young in the population, but we know that in Malaysia, of people aged 18 years and above, 1 in 3 will have high blood pressure. But that's not the issue. The issue is that it is not detected. More than half of the people who have high blood pressure do not know they have high blood pressure. And so when is it ever picked up? When they come in with a stroke. And this is exactly what happened to a patient that I came across. He was a taxi driver, 52 years old, came in with a very dense stroke, very bad stroke. So I asked him, "Did you have high blood pressure?" He says, "No, I have no high blood pressure." Then I asked him, "When was the last time you measured your blood pressure?" 20, 30 years ago, when I was 20 years old. So what does that tell us? It tells us that high blood pressure has no symptoms. It's a silent killer. And so how are you going to pick up that you have high blood pressure? The only answer is measure your blood pressure. Things like I have a headache, blood pressure, all not quite true because it is asymptomatic. So therefore, you have to measure your blood pressure. Then the question is, how often should you measure your blood pressure? Obviously, if you are very well rested and you measure, it seems quite normal. When you're active, it seems a bit higher. So what we want to do, obviously if you come to a clinic and I measure blood pressure and it's 160, very likely a high blood pressure. But it is neither here nor there, the borderline, and these are the borderline cases that is more important because the majority of people have that sort of blood pressure, is that we need multiple readings, many readings, so that we can average it out to represent what your blood pressure over a day, in other words, what's the load of the blood pressure on your heart is. And this is where multiple readings are important. We have, of course, advised patients to use the usual cuff set, the machines that many of you have parents who have. But of course, the alternative are the wearables, which are of course much more convenient. So this is where the wearables will be useful. The other thing, of course, is with high blood pressure, there are 3 things I want to tell you. One is the importance of high blood pressure. Know your numbers. So what's the number for high blood pressure? Anyone? I don't have a watch to give away as a prize, but let's just do this game. What is considered as abnormal blood pressure? This is where you know your numbers. Because I teach medical students, I'll pick on them and say, what's the number? And they all panic. They all want to sit at the back and not in front. So I pick on the back benches instead. But never mind. Anyone with a blood pressure of 140 over 90, either is high, you are considered to have high blood pressure. If you have a blood pressure of 120 by 80 or less, you are quite normal. So what happens to in between 120 and 140? You would be borderline. And again, these are the borderline people that you need to monitor, make sure it doesn't go any higher. You take preventive measures to try not to get high blood pressure. And obviously that will mean things like losing weight, exercise, eating less salt. Less salt. Salt is very important in reducing blood pressure. I'll come to that in a little while. That's first message is know your numbers. Second message is if you have high blood pressure, you ought to get it treated. There's no 2 ways about it. Treatment is very good. In my research I've done, treating blood pressure over a period of 10 years, what I saw in the patients is there's a reduction in the number of strokes. The kidneys get preserved, less heart attack. So definitely it is advantageous. Okay. I do not get any benefit from getting patients to go on medicine because I work for the government. If I don't prescribe medicine, I don't make more money or less money. It makes no difference to me. My interest is to get patients to take their medicine. So very important, take your medicine. get your blood pressure down to as low as you can without having symptoms. The last message, of course, is how can you prevent blood pressure? One of the important, most cost-effective way of reducing blood pressure, in preventing blood pressure, is to eat less salt. I don't know whether you all saw the Star article maybe 2 days ago, when the Ministry of Health said the ROI. How many of you, I think all of you know what's ROI? When I first started medicine, people told me ROI. I said, what's ROI? The returns of investment for salt reduction is $60. For doing exercise, doing smoking, is only $6. So it goes to show how useful salt reduction is, how powerful it is to reduce the blood pressure, which in turn will reduce strokes, reduce heart failure, and reduce kidney disease. So very important. So my message to you is to do that. And of course, the variables, as we have heard Professor Sturgill say, the variables give us more reading, so it becomes more accurate. We also know that if your blood pressure at night while you're sleeping, in a normal person, it goes down, what we call dipping. If it doesn't go down, it signals the fact that you are more at risk to get cardiovascular events like stroke, heart failure, and so on. So that's also useful information for me as a doctor to look at it and then decide how I want to change your medication. So that's useful information as well. And of course, the other thing is the rise early in the morning, what we call the morning surge. Asians in particular, Japanese, Koreans, ourselves, are more prone to a rapid rise in blood pressure, and that's the time where most of the strokes, the high blood pressure all happen. That is again based on statistics and the reporting of illnesses. So I think my 10 minutes is up. So let me recap 3 messages. Know your numbers, 1. Secondly is if you have a blood pressure, get it treated. Thirdly, reduce your salt intake. The other thing about knowing your numbers is, if you are very normal, our advice is measure it at least once a year. But if it's borderline, you should do it more often. And this is again where the variables come in. Because blood pressure doesn't, one day you have no high blood pressure, next day you have high blood pressure. It goes up slowly. So therefore you already get warning with all these multiple readings that you have gotten. I think that's all I want to say.